dailytalk.com.
Welcome back to Let's Talk Business, where we invite businesses or individuals to come and talk about their business, their service, or their event. And today we have an event we're going to talk about, and our guest is Farhat. Hanifi. Was I even close?
That was pretty good. You did a good job, yeah.
And we're talking about the big event, which is?
So we're putting on a 5K asthma awareness walk. It'll be hosted on Saturday, November 9th at 8 a.m. at Woodward Park. And it's put on by our nonprofit organization, which is called the Central California Asthma Collaborative. Mm-hmm. And our main purpose and vision is just to reduce the burden of asthma in the San Joaquin Valley.
Well, who can be in the walk?
Anyone can be in the walk.
Is it a competition? Is it a race?
It's a fun run. So you can run if you'd like. You can walk if you'd like. We encourage you to bring your kids because we want it to be a fun community event. There will be, you could even bring your dog or your cat or whatever you'd like to bring. So
is it
it's
about
open for the whole
awareness
family
as well?
It's mainly for asthma awareness. So
a lot of us don't know people with asthma, or probably we all know someone with asthma and just don't know it.
you wouldn't believe how frequent asthma is here in the San Joaquin Valley. 1 out of 5 children in Fresno County actually suffer from asthma, and I'm sure if we were to look around the room and ask around the room, we'd notice that everyone here knows somebody that has asthma.
One of our guests is saying he has. Is it from our environment? Is it from particles in the air?
Yeah, it's a combination of both. People don't really know what the cause of asthma is. There's speculation, so it could either be from your environment, so from our poor air quality. That's why people speculate as to why it's so prevalent here in Fresno. We're 30% higher than the national average of having asthma sufferers living here in Fresno County, or actually in the San Joaquin Valley. But it's also genetic as well, so it can be a biological predisposition. So.
Now, who makes up the Central California Asthma Collaborative?
So we are a local nonprofit organization. We've been around for the last couple years, but we primarily came out of the Fresno Madera Asthma Coalition. So this has been a process that's been going on for at least 10 plus years. We have partners all up and down the San Joaquin Valley. We work with the different asthma coalitions throughout the counties. We promote what's called the Ran and Flag program, which is, some of you that have kids might have seen the different flags flying outside of elementary schools. Those indicate what color or what the air quality is for that day. Air quality
is that day, yes.
Yeah, exactly. So red means bad, that sort of a thing. And so we implement that all up and down the San Joaquin Valley.
So if a kid knows he has asthma, with the color flag, he might know, oh, today I better take it easy or something
exactly,
like that.
Right. And it's for the general public as well, because there are certain days that all of us should not be going outside, running, doing whatever it is. So.
I guess some people have asthma and don't even know it.
Right. No, that's completely true.
And what is it? Just an inability to take the deep breaths and get the oxygen you need?
Yeah, to an extent, that's basically what it is. But when you have more severe asthma, it's something that you deal with on a constant basis. Some people, a trigger can be something as simple as running. So that's why some people that have asthma aren't as physically active as they should be, even though we encourage that they should be, just to for lung growth, but it can be something that people deal with on a daily basis.
Now, I understand you actually brought us a film clip.
Yes.
Well, before we get to that, let's say again a couple more times if we can. When and where is this big event?
So this is our 5K Breathe Easy Asthma Awareness Walk.
How much is 5K? Is that like 20 miles or something?
It's like 3.5 miles.
We don't know what Ks are here in America. So under 5 miles, three something.
Yeah, you can run, you could walk, you could do whatever it is. It's mainly just to promote asthma awareness. It'll be hosted at Woodward Park on the Lewis Eaton Trail. You can go to our website, which should be listed below, and you'll get some more information under our calendar links to register and to purchase tickets.
Everybody should get through that distance in an hour or an hour and a half.
Yeah, definitely.
It's not like a 5-hour thing or anything. And are they supposed to get sponsors or something like that? How does it raise money?
So we actually are just trying to have this be a community educational event. We aren't trying to raise money. I mean, that would be a plus, but we just want people to kind of have asthma on the forefront of their mind. And on top of that, we have some great sponsors that'll be giving out some great things. So Clinica Sierra Vista is providing free flu shots. So if anybody'd like to come out, they're giving it out until they run out of them, essentially. Okay. So we have some good food trucks there. It'll be a fun community event, as well as bubble performers, clowns, that sort of thing.
Performers.
Yeah.
Now, the date is when?
The date is Saturday, November 9th. Registration starts at 8 a.m. The actual
So about
walk
2
is
weeks
also
from now, I
tonight.
think.
Yeah,
2
exactly.
Saturdays from now. So we'll run the show a bunch of times and try to get people
Oh, that's
there
great.
to
Thank
know
you.
about it. If you have asthma, you don't have asthma, you can go.
Yeah,
Just
definitely.
Maybe just go give support. If you know somebody with asthma, go out there just to give some support. Let's watch the video clip.
Okay, thank you.
It's all right.
Responsible for more than 1/5 of the nation's food production. But this land of plenty is also among the poorest areas in the country. Besides having limited access to healthcare, the Central Valley's poor are exposed to some of the worst air pollution in the U.S., much of it billowing from the caravans of trucks traveling along Interstate 5 and Interstate 99. The Central California Asthma Collaborative's Aim for Fresno program does assessments and interventions in the homes of asthma patients in Fresno and surrounding cities. AIM stands for Asthma Impact Model. The program identifies asthma triggers in the home and educates families about low-cost modifications they can make to reduce their symptoms. Nunu 6A, Aim for Fresno's program coordinator, talked about asthma in the Central Valley and the unique challenges residents face in treating the disease.
A lot of these people don't have insurance. You know, there's a lot of uninsured people that are not able to have access to care, and a lot of people rely on emergency room, you know, as their primary, care, and you know that's a big problem for everyone because you know emergency rooms get crowded, you know, and people are not getting the care that they need. But also another factor is because people don't know about, you know, how to live with asthma, meaning that, you know, they don't know that within the home, you know, there's a lot of triggers that could be avoided, you know, but a lot of people don't know about that. You know, they don't have the education. Caregivers or parents, you know, they have to, you know, change, you know, their the way they live their lives, you know, in order to accommodate, you know, their kids, you know, who are suffering from it, you know, by you know, missing time from work or, you know, taking their kids to the hospital, you know, so it affects everyone.
Vanessa Salinas is a mother of 3 living in Chowchilla, a city about 40 miles northwest of Fresno. Salinas' 5-year-old son, Abram, had severe asthma. At one point, he would suffer asthma attacks at least twice a week and would be hospitalized 3 or 4 times a month. His severe asthma prevented him from playing outside with other kids his age. Meanwhile, Salinas and her husband frequently had to miss work to take care of him. On top of that, they had to drive several miles just to get to a hospital that was able to treat him. But after Salinas reached out to the Central California Asthma Collaborative at a local health fair last year, she learned more about how to minimize asthma triggers within her home, such as removing stuffed animals and asking her neighbors to avoid smoking around Abram. Since then, Abram's symptoms have improved, and he hasn't had an attack in 6 months. Selena shared her family's experiences with Abram's asthma, including the challenges they faced.
Vivieran en otro sitio fuera del Valle Central, ¿su asma sería diferente o cree que no?
Yo pienso que sí es diferente, porque cuando vamos para el área de la bahía o para las montañas, su condición cambia. Cuando hace mucho frío aquí en el Valle Central, él se enferma. Hemos ido en el tiempo de nieve a las montañas y él está como si nada. Él no se enferma, no le dan ataques de asma. Yo consulté con el pediatra y me dijo que posiblemente era la contaminación que hay en el Valle Central y los químicos y todo eso, lo que puede desencadenarle el ataque de asma. Íbamos al hospital y llegaba él con muchos puntitos rojos en todo su cuerpo, de tan fuerte y tan grande su esfuerzo para respirar. no le salía la voz. Esta parte de aquí se le ponía oscuro, sus ojos muy hinchados, sus labios.
Oh, wow.
Y muy ronco, por más que él trataba de hablar no se podía.
Ay, pobre.
Obstáculo en transportación no ha habido porque gracias a Dios tenemos transporte. Pero lo único que yo sentía es que por el medical que yo tenía no me lo aceptaban donde yo, el lugar más cercano donde le pudieran dar atención médica no me lo aceptaban. Muy mal. Impotencia de no saber cómo cuidar a mi niño de que no le pudiera, de que no le dieran esos ataques de asma. Me sentía culpable porque no tenía yo la información adecuada para ayudarlo, para cuidarlo. Más que nada para prevenir esos ataques de asma, porque es muy difícil batallar con el asma en un niño. En las noches no pueden respirar, no pueden jugar, no pueden tener una vida normal como cada niño. Como padres buscar la información, porque la información está, pero muchos no nos informamos.
It's a big issue in the community, and being part of it, makes me feel good, to educate the community, what can we do as a whole, to help those people, that are suffering from it.
Wow, what a story. I didn't realize the symptoms, how prevalent it was, and what families go through to make sure their kids are taken care of.
Yeah.
And the lack of knowledge. She doesn't know what's causing it, or she wants information, and there just isn't a ton out there for her.
Right.
No answers, not a lot of answers.
And that's what we try to do as an organization, is just to give that small little 10-minute spiel of what asthma is, how to use the medication, and educating the parent and the child about their asthma. So,
Well, I guess one good place to learn more about, or just give support, or just to find how many people are out there, is to go to the Asthma Walk. Is that what it's called?
Yes, please. It's called the 5K Breathe Easy Asthma Awareness Walk.
5K Breathe Easy Asthma Awareness Walk is November the
9.
9th. So
Yes.
is that 2 weeks or 3 weeks? 3 weeks maybe. 2 or 3 weeks away.
Yeah, one of
So go
those.
out there. It's at Woodward Park. Is it early in the morning?
It's registration starts at 8, but the actual walk itself starts at 9.
9.
Yeah.
But look at our website,
CalAsthma.org.
centralcalasthma.org. Go there and you'll learn everything there is to know about. Thank you so much
Thank
for bringing our
you.
guests and bringing
It
this
was wonderful
important
meeting you.
subject to light here on Let's Talk Business. I'm Mike Briggs. We'll have more right after this.